Welcome to Alimentary, the podcast series where you will learn about your amazing body, how it works, and of course why food is so important. We have our store cupboard staples at the end of each episode. We'll also learn more about lifestyle tips and therapies to help you to influence your health in a positive way. Welcome back to Alimentary and thank you for listening. Today's conversation comes at a critical moment for brain health. Globally, dementia is one of the fastest growing public health challenges, with Alzheimer's disease being a leading cause. Here in Ireland, an estimated 64,000 people are currently living with dementia, a figure expected to more than double to approximately 150,000 by 2045 as our population ages. In the United States, the scale is even more striking. Over 7.2 million people aged 65 and older were living with Alzheimer's disease in 2025. That's roughly 1 in 9 older adults, with numbers projected to rise to nearly 13 million by 2050. What is becoming increasingly clear and hopeful, however, is that dementia is not inevitable. A growing body of international research suggests that up to 45% of cases may be preventable or delayed by addressing modifiable lifestyle factors, including nutrition, physical activity, metabolic health, sleep, education, and social connection. But what's often missing is how these factors are actually addressed in practice. Because knowing what matters is very different from having a structured system to measure, monitor, and improve it over time. Which brings me to our guest for this episode. I am delighted to welcome Emer Sexton, a neuronutritionist and the founder of NeuroNourish Clinic based in Cavan Digital Hub, a brain health clinic focused on early cognitive support and dementia prevention. Emer combines clinical data, cognitive testing, and structured behavioural interventions to identify and reduce the early drivers of cognitive decline long before symptoms become established. Her work focuses on something most healthcare systems still don't provide, which is continuous monitoring of cognitive risk, combined with personalised, data-led interventions over time. Built on her own personal journey of recovery, NeuroNourish is driven by a clear mission: to give people clarity, structure, and control over their long-term brain health. This is particularly relevant for individuals who are beginning to think more seriously about their cognitive future, whether that is due to family history, subtle changes that they're concerned about, or simply a desire to take a more proactive approach. Today, we'll explore Emer's story, the science behind neuronutrition, and what a structured long-term approach to brain health can actually look like in practice. So please join me in welcoming our guest, Emer Sexton. Emer, thank you so much for joining me this morning. I'm very excited to hear about your work and about NeuroNourish Clinic. I think what you're doing is fantastic, but we'll come back to that in a couple of minutes. I was wondering, could we maybe start with you sharing a little bit about maybe your professional background and what kind of drew you into the field of brain health and cognitive well-being in particular?
Yeah, hi Lynn. It's great to be here and thank you so much for having me. Of course. So my journey in health started quite some time ago. It's always been an interest of mine. And my background is in nutraceuticals. For anyone that doesn't know what that is, it's essentially any natural substances that can have a medicinal-like effect. And then I also studied health coaching. And what drew me into this area of preventing cognitive decline, Alzheimer's prevention, dementia prevention, was really both out of personal experience and also just seeing it in a lot of people myself. I have my grandfather had it, died with it, and I had some cognitive issues myself. So I was cycling through Dublin and I was knocked off my bike and was unconscious for a few minutes, went to the hospital, everything seemed fine. And then I had really terrible concussion for months, if not years after. And I couldn't really understand what was going on with my brain and why I couldn't sit down and focus the way I used to be able to, and essentially just do simple tasks. So that's one form of cognitive function. I also have a slight neurodivergency myself. So just working with your own kind of cognitive struggles, but then also seeing it in a population wide led me to study it real academically. And then I proposed, I suppose, a couple of nutraceuticals combination to help prevent mild cognitive impairment turning into Alzheimer's. And from that, I realized this is massively preventable. And this is where we can have the most impact for people is when they get that first couple of symptoms, they might think they're going to lose their mind. And what is out there for them if they're worried that they're going to get Alzheimer's? Maybe they've had a parent that have had it before. What's out there? Where can they go get tested? And once you start digging into a problem, you start discovering a lot more along the chain and about the healthcare system and everything. So that's really what led me to set this business up
Yeah.
a few months ago.
That's fantastic. It is very scary. I'm sure it must have been a very scary experience for you to feel that, your brain wasn't working the way it had done. And so to sort of push through the fear to actually find your solutions yourself, is admirable. And then of course it's heartbreaking when you see someone in your family, who you lose even before you lose them because they're not
Absolutely.
quite themselves. So oh my gosh, there can't be much better of an impetus, for where you are now with your business. And it is, you're right, there's a lot of families that are living with family members who have dementia and Alzheimer's, and it is heartbreaking and it's scary because in the past we thought of it as inevitable if it was something that was in our DNA, or if it was in the family. But actually now, as you've mentioned, there are things that can help, in particularly in the early stages. So
Absolutely. Yeah.
yeah,
And
and that's empowering for people to know that.
absolutely. That's the most empowering part of it. And I found that empowering through my own, you try different things with nutrition, you try different things with, lifestyle, etc. And when you start to regain that power back in your mind and know that these lifestyle things actually work to improve your cognition,
Mhm.
that's not only empowering, but it feels 10 times better when you get to have somebody else experience it through your own advice.
Absolutely. You have the conviction and the passion because you know it works from your own experience.
Absolutely.
So I guess when it came then to setting up NeuroNourish, where did you see the gaps, I suppose, in the healthcare system or the services that were out there for people?
So I think the field of medicine is changing more to a preventative approach. So first of all, people can give out about the conventional medicine system for decades, and when you work, I suppose, in alternative health, I think you can get into that loop. But or you can say no, the entire thing is changing, and the preventative model is coming up quite a lot. And I'll tell you where so every doctor, whether it's a GP, a geriatrician, a neurologist, or a psychiatrist, they have their lens that they're going to look at you from. And typically they're trying to take a collection of what your symptoms are and put it down to one diagnosis. And diagnoses can be extremely helpful, but where do you go from a diagnosis? And particularly with the disease of Alzheimer's, there 42 billion has been spent to find a drug on this, and only subtle there is very little improvements that made with the drugs if somebody gets it. It is more so a stall. So that's one area. But the second area is if you're worried about your cognition or you're doing a cognitive test, if your GP does a test on you, the neurologist or the psychiatrist may do a different test. So where is who's testing the same thing to come up with and testing you over time. So that was the first thing. Who's testing a cognitive baseline for people? Is it normal? So there's an issue there in the diagnostic space. So diagnostics is the first issue. The tools that can test for cognitive decline early on, because it does begin, 20 to 30 years before it actually can be diagnosed as a disease. That decline is happening, and we need more sensitive tools. So that was the first area, finding a diagnostics neuropsychology tool that can actually figure out, that's sensitive enough for your age to figure out what areas of your brain is struggling.
Just going back to what you mentioned about the diagnostics, do you think that there might be an issue because what is normal for one person might not be normal for another person?
That's right.
Yeah,
So that's where you have to take a lifestyle baseline. And also, it's a 4 to 5 hour intake process. We know that in the States, there are these specialized clinics. So it was the same idea with kind of the BlackRock clinic, where they kind of specialized in dermatology and skincare. That's an American model. In terms of when you go over there, there's a neurology clinic that is doing that for um, anything to do with the brain or cognition. So there's a neurology specialist place that you can go if you're having these struggles and worries. In Ireland, we don't really have that. We have a different healthcare setup. So where are you getting that test initially? And it can be something that people are fearing. So if you are worried about your cognition, well, actually, it's mostly people's families members that are coming to me, from my husband, from my mother, from my sister. Uh, and a formal diagnosis test might be a little bit scary. They might be feared that they could get their license taken off them, all of those types of things. So something more private, but at the same standard, and if not even more sensitive, needs to be in place for people to be able to assess, is it normal for them? So you need to put together somebody's cognitive baseline, which is how is your brain functioning day to day, a personal experience intake form, your family's intake form, because they're going to be assessing you and watching you day to day.
good
And
point.
then your
Yeah.
yeah, and then your biological baseline, and then we get into the trying to find the root cause of why that's happening.
Mm. So it's more of you're really looking at what the risks are of developing it in future. So you're not
Yes.
giving a formal medical diagnosis. It's more right. And establishing a baseline as well that can be followed up, say in the coming years as well.
Yeah. So like our programs, we do the cognitive baseline, and then we do one at month 3, month 6, and then again at month 12.
Mm.
So they're the same neuropsychology tools that if you thought you had mild cognitive impairment, you would be able to get tested. Things that you can see improvement on quite quickly is things like your processing speed, your recall memory. Those can be improved. Executive function might take a little bit longer to have improvements on. Those are terms that people might not understand, but they show up as your everyday cognitive issues, whether that's trying to remember somebody's name. So that's your objective. So in comparison to everyone in your age, is there decline going on here? Is it in a red flag, an orange flag, a yellow zone, or a green, or are you really, really fast? Is your cognition really fast? Um,
So
yeah,
it's like being assessed for your heart health or,
exactly.
your any other organ in your body. Our brain is an organ as well. So what you're doing is assessing is how optimally is the brain working.
That's
And then
exactly
of
it.
course, there are things they can do because I mean there's we think of, say as we are aging, or in menopause, we can have issues with our memory too. And, is there any way of explaining the difference between sort of normal aging and cognitive decline? Or, I mean, do we have to, we think that it's just natural to sort of age and lose memory, but maybe we don't have to. Maybe we can actually keep I suppose, honing or keep exercising our brain in order to keep our brain health long into old age.
Your brain, like, you hit the nail on the head. You said the brain is a biological organ. So there's a doctor in the States that I followed, and Dr. Dale Bredesen. I think the only qualified practitioner in Ireland that practices his method. So the brain is like one of his physicians that was on she's an incredible doctor, but she describes it like an orchestra. So your brain is like an orchestra with multiple string instruments. And it's about finding, fine tuning those instruments and the chords on those instruments that are slightly off. And you can do that and you can get your orchestra back playing beautifully. Now, not at any one point is your orchestra and all of your strings going to be intact, but you can definitely optimize them and improve them. So when you take the cognitive baseline, you want to go on to the biological baseline. So you want to figure out what the risk factors are. These are the things that you have control over. You have a nutrition podcast. I don't know how many times blood sugar has came up, metabolism, vascular health has come up, the blood-brain barrier, gut health. These is the same science. These are the things that you're going to want to fine tune so your brain can work optimally. So that's the building blocks, that's the environment that your brain is in. But then also you want it to grow, which is the thing that I seen the missing part in. So you can eat a perfectly brain healthy diet, but you're not growing your brain. And then there's ways and means to do that as well.
So is that like we'll say if you eat healthy and you don't exercise, you're not sort of maybe building as much muscle as you could. So do you mean you can nourish your brain, but you also need to exercise it?
Absolutely. You
Okay.
need to exercise it.
Mm,
So exercise it as in exercise the physical body,
mm,
but exercise it as in exercise your brain.
yeah.
So can you think of the last thing that you did that challenged your brain and that you recalled what that was? We do it all the time in school and we put kids through it.
Mm,
Why do we do it for children? Why do we put children in a classroom so their brain are exercised, so their brains grow, so they
yeah.
have a normal rate of brain growth? And then that ends at about 22. You get into a job, or maybe it ends at about 25, depending on your level of education, if at all any. But what are you doing then when you get to retirement age to grow and to stretch your brain?
Mm,
That's the question that people need to ask, whether it's brain training, some of the tools that we use in clinic, or is it that people decide at 55 that they're going to learn a new language
yes.
or a new skill?
Learning, seeing new places.
Absolutely.
Yeah.
And even if you're watching a television show, write about it, recall it, discuss it.
Mm,
If you're watching the news, talk about it with somebody else, recall it, discuss it. If you read comprehension in school, if you can remember those English and you have to
yes.
write about them, read them. And also, there's people in the world that are very good at reading, for example, and that's part of their habit. So that's keeping their brain cognitively active because they're recalling it so that they can put the story together. Interests are extremely important. So there's multiple ways to do that. And then, of course, you're doing it through your physical body because your brain is responding to your senses. So another thing that we do with children that we forget to do with ourselves is normal physical development. So are you putting them through sports so their reflexes are fast enough? What are you doing for yourself for your own reflexes or your balance? So it's
Balance is an indicator. Is that one of the things that you would measure? Isn't
yes. So balance is an indicator. So it's the test is very simple. It is one of the indicators for cognitive decline. Muscle mass is another one, and then of course the cognitive tests themselves.
yeah.
Yeah.
Yeah, because blood sugar, uh, Alzheimer's, it has been, I've heard it being referred to as type 3 diabetes on occasion, So, I mean, that means that our managing our blood sugar levels is hugely important to our brain health as well.
It is one of the most important things. And why
Yeah.
it's most important is because it's usually the area that people struggle the most with. So your metabolism is how your body processes energy. And if that's off, that drives inflammation that essentially sets this fire off in the brain that creates the wrong environment for you to function. So I'll just give an example. If you woke up in the morning and you had a packet of sweets or a chocolate bar for your breakfast, anybody want to do a self experiment, try it and see how your cognition is an hour later. It's just a test. So some people are living with that cognition because of their metabolism in their
Mm.
50s and 60s. And it's simply down to let's get some blood sugar regulation. And the transition from having dysregulated blood sugar or even insulin resistance, which is the start of it, or pre diabetic markers, is simply just getting your body to respond differently to how you process energy. Sometimes we have to take a little bit more of an extreme break from those. So your body has three different types of energy where you get energy from. And it's about making sure that you're getting the energy to the brain. So you can change your diet. I like to call it engineer your diet to make sure that your brain is getting the energy that it needs.
Exactly. And um, for several years there, fats were demonized, and actually our brain is mostly fat, really, isn't it? Fat and
Hugely.
water. Like, so we need our healthy fats for sure. So it goes back to what's good for our body. I think that maybe we used to think that our brain was kind of separate, that when you were eating healthily, it was all for, for our organs and for our body as opposed to our brain. But actually, it's equally, if not more important for the brain as well. What we eat impacts the brain.
Hugely. I mean, so first of all, the brain is a biological organ. So I like to separate the mind from the brain. People like to think that their mind is their brain.
Yeah.
That's why they feel so attached to it and so sensitive around testing it.
Mm,
It's just an organ. Would you be the same way of getting an ECG for
exactly.
your heart? So when we're doing a cognitive test on somebody, just think of it like an ECG on your brain. How
Mm,
is it functioning? And it's not your mind. It's essentially just, are the switches, or back to that orchestra, are the strings on those, violins, are they playing okay?
mm,
And how can we fix them? Let's figure out what ones are off and how we can
mm.
fix them.
So if someone was going to come to you, Emer, you combine, I believe, nutrition, lifestyle changes, and obviously with your clinical insights to engineer is a great word, like a program for them. So would that happen in stages? What would sort of a first consultation look like?
So we don't change anything about your lifestyle for the first month because we're trying to figure out what a part of so we do a cognitive baseline, biological baseline, which is your bloods, your body composition, and then we're going to do a lifestyle analysis. So I would say there's things in your lifestyle that is, contributing to decline, and then there's things in your lifestyle that are contributing to growth. So let's try and get the growth ones a little bit higher up than the decline ones. So for the first month, we're just analyzing you. So we're taking your bloods, we're taking your cognitive testing, and we're doing a lifestyle assessment. There's a lot of learning that comes with this. So it's, CBT, you're learning about yourself. And then people start to make changes in the beginning because they're being assessed. And that's where assessment is really good because you have something to work towards. It's the same with learning, any
Yep.
gamification of it. So the first thing that we start with is that cognitive. The first lifestyle change that we do is actually we get your brain stimulated. So we give you a prescription of what we call brain training, testing, especially if you're not doing it in other areas of your life. If you've fallen into the same routine over life, which is very easy to happen, and you're very comfortable. So the brain likes a tiny bit of discomfort to start pushing and growing and learning and just keeping it a little bit alive. Um, so then we look at your diet and we try and tailor it to what's came back in your bloods. Is it, and we figure out what's the cause of your cognitive decline because everybody's declining after the age of 20. Um, so what's the cause of the decline? Is it vascular? Is it metabolism? Is it, because it could be glycotoxic? Is it inflammatory? What is the cause? So we're figuring out the cause and we focus on two of those root causes first. And that will be seen in your diet, the supplements that we're recommending, and maybe little conversations with your doctor if there's some medication that needs to be had. We start introducing those changes kind of subtly. Then there's the big one that people forget is your lifestyle. So sleep is absolutely vital. So we're testing people for what type of sleep they're having. And I think Lynn, you're going to know this yourself. Like wearables are everywhere. People have their watts.
Have
People are
one on.
collecting, exactly. People are collecting data on themselves all of the time. We have the tools to do that. So we can actually translate the data that's collected on your everyday into brain health science. So we can take the sleep that it's having and how restorative it is for your brain. And there are tweaks depending on what one is suffering. Is it your REM sleep or your deep sleep that we can tweak for you and help you put in place over the first 3 months? So they're the most heaviest months. And then 6 is sort of getting into the swing of it, making some mistakes, feeling like this might be difficult for me. I'm a bit bored. What can I switch up? And then testing again at the 6 month mark to see where the improvements are in your bloods.
Great. And of course, when you see improvements, that gives you motivation to keep going.
Absolutely. And even if you're not seeing the improvements in your cognitive testing straight away, people typically see great, like fantastic improvements in their bloods.
Mm.
And it's like translating those bloods to people to say, wow, your metabolism is really increasing. Little red blood vessels floating around in your blood are not as damaged as by sugar anymore. How exciting is this?
I
You're out
know.
of the pre-diabetic range.
Super. And that goes back to the term that you used, glycotoxic. That's to do with the blood sugars, isn't it? Your glucose.
It is.
Yeah,
It's
yeah,
energy metabolism,
yeah.
exactly.
Brilliant.
And you spoke about fats earlier. So there's also
Mm.
nutrient deficiencies that people might have. So I give the example of you're going to know yourself the harmful effects of high homocysteine levels. But actually, a lot of the time when people have high homocysteine levels, their B12 and their folic acid in their blood show up absolutely fine.
Yes. So B12 is a topic that I'm very interested in. I'm celiac. So of course anybody with digestive issues, particularly as they age, can have B12 deficiency. I have a whole website. There's a link on my own website to a whole website about B12 deficiency. And Sally Patchlock, have you come across Sally?
I
She
haven't.
she wrote a book called um Could It Be B12, An Epidemic of Misdiagnosis? So she's a nurse in the States. She's been campaigning for years for testing. And again, she recommends the homocysteine test. So
That's one test
she
that we do in clinic
Brilliant. Brilliant.
without.
I'm really interested to hear about that because it has such a huge impact, B12 deficiency, So she actually helped me with my website as well, just with all the studies and stuff like that. So I'm really glad to hear that you're testing for it. That's brilliant.
Test for B12 and test for
Mm.
homocysteine. It is absolutely vital for not only your brain health or cognitive decline, but the science. I think the most interesting thing is the science and the functional medicine for brain health is the same for your mood, how you
Yeah.
process stress, how you interact, because your cognition affects every area of your life. But it's not just your cognition, as in recalling memory, doing multiple tasks at once, or your processing speed. It's also your neurons. So it's neuronal health. So it's your mood, how you sleep, how you're interacting with people. When that's flat, you feel it.
Mm.
And when doctors talk about a chemical imbalance, trying to put it down to one root cause and then prescribing something like a SSRI, that is one chemical balance. But B12 has over 800 chemical functions in the body. So if serotonin has, I think, something like 60 something functions in the body, but B12 has over 800. So if your B12 is off or you're not absorbing it, all of the effects that it would have on your body, your gut, your mood, and the health of your neurons, essentially.
Yeah. Emer, you mentioned that really our brain, the decline can start, decades before we actually are diagnosed with a condition like dementia or Alzheimer's. What age? Well, first of all, I suppose, what age groups are you seeing people coming to you at the moment? And then what age would you recommend that we start maybe tracking our brain health?
So people will be surprised by this, but your brain starts declining at 20 years old.
Okay. I'm a long way past 20. I think I
Yeah.
need to make an appointment.
but it's also growing at the same time. So
Okay.
growing and maintaining itself at the same time. The youngest person with Alzheimer's disease diagnosed was 20 years old. So we know that.
Wow.
That's pretty shocking to people. Um, and then there are multiple things in your life that increases your risk. So there is a blood test that we can send off for, which costs about, I think, maybe €500 to test if there's plaque. And what the medical diagnosis of Alzheimer's is, whether there's plaque or p-tau in the brain. So plaque is that your brain is not detoxifying itself, and amyloid or plaque is, it's like a sticky tar, like a cholesterol. And then p-tau is like a protein. So we can do that test, no problem. But why not test for the risk factors that's causing it? They're the things that you can change and change within 3 months, Lynn.
Yeah. Yeah. That's
Your,
amazing.
your body, you have a brand new body every 15 years or something. Your bloods, um, you have new blood cells every 3 months. That's why we do testing of bloods every 3 months. You have a new skeleton every 10 years, brand new bones every 10 years.
Mm.
You have new gut cells every couple of days.
Yeah.
So change is inevitable, and your brain is also sort of repairing itself. So it needs the correct environment to grow. So those risk factors like low B12 nutrient status, poor vascular health, glycotoxic, so that's your metabolism, chemical, or then bio and biotoxins, so your gut microbiome, and then the biotoxins that could be in your body. These all things cause dementia. So if somebody has an elderly parent or has looked after somebody, if somebody gets sick, they can go into a state of delirium because they have an infection in their gut, for example. That really
Mm.
causes it as well. That has huge effects on the brain. But there's underlying toxins in the body as well that can cause it too.
Okay.
So multiple causes.
So if someone has if someone feels that they're concerned about their cognitive decline, that's certainly a time when they should come and see you. If someone is, say, has a parent or a grandparent who has suffered from dementia or Alzheimer's, and they're concerned, they think, well, what if I get it? Like, then they can come really at any age to you to start
Yeah,
tracking
so we
and
see
monitoring their brain health.
exactly. So we see people from 40 plus.
Mm.
I don't really go under that.
Okay.
40 plus is what we see people as. We have people who are recently just retired.
Mm.
So that's a change in, what they're learning, etc. So how do you keep
Yeah.
the mind active after retirement? Another person is, I particularly even professionals in their 40s where they kind of hit that midlife or 50s, and they're going, I can't keep up. My brain doesn't work the same that it used to. So I I used to be able to do X, Y, and Z, and it's just not working the way anymore. And so anything from 40 up, you can see that. And you're classed among people in your age when we do the cognitive tests. So it's not like you're a 40-year-old and we're classing you in the same category of how is your processing speed in comparison to a 90-year-old or a 20-year-old. We're classing where our tools are sensitive enough to test for that.
Yeah.
Um, so anyone worried or noticing those symptoms, and I think people particularly have an emotional attachment and really want to come when their lifestyle isn't important enough for them, and they have a family member that have had it. That's a huge one. So whether it's an uncle of theirs or a parent.
Does the work ever get heavy? Might not be the right word, but I'm sure it can be emotionally charged. And I'm sure you're dealing with people who are fearful. How do you, I suppose, navigate that?
Yes. That's a really, really good question. It's extremely emotionally charged. There's a phrase that my mother would say is you control the controllables.
Good
So that's
advice.
what I stick with people. It is, what can you control today? And then also sticking with the positive mindset. So a growth mindset is a positive mindset. You want to grow your brain, you want to keep it active, you want to keep positive. So I would do a lot of work on myself to remain positive and have that belief, because I know the science behind brave improvement for people, even if they're not seeing it straight away.
So they can feel that conviction from you, and you can instill that confidence in them that what they're doing, if they are consistent, will reap the benefits.
Absolutely. You might not feel it straight away. Some people feel changes within a couple of weeks, and that is incredible. But again, the earlier you come, not leaving it until you're in your 70s or your 80s, just your faster your repair process is in general. And
Um, so sometimes, Emer, it can be very scary for people to admit that they're concerned about, their cognitive function, about their brain health. Sometimes people just don't want to maybe face the reality that maybe there is something happening. Is there anything that, any piece of advice that you maybe, you've come across, something that someone has said to a family member to encourage them to go? Or I guess it varies from family to family.
honestly, it really varies.
Yeah.
And people will decide to work for me and then work with me. And then a few days later, they're kind of going, oh, no, actually, no. And it is a really emotionally charged topic. And they're kind of
Mm,
going, making excuses. But that's what any change, Lynn.
that's right. Yeah.
That's what any change. People always, you can list off a number of excuses, but on the other side of the page, if you listed off all of the benefits,
We
that's what you
can,
need to focus on.
yeah. Our comfort zone is very comfortable.
Exactly.
So
So some
yeah.
people are coming into it with a fear based. So their motivation is, I don't want to end up like my uncle that had it. My mother had it, and I don't want to end up like that. It was a very tumultuous time for us. So there's people that are coming from a fear based. There's people that are coming where your brain health, your cognition is a fantastic motivator. It's a fantastic motivator. It's also such a social disease because if your cognition declines, you are relying on people around you to look after you.
And we all want to be independent for as long as we can.
Cognition and your physical health, they're what keeps you yourself.
Mm.
Because your mind is one thing, as I said, separate your mind. This is not you. This is just your brain. So one of the things that we do is very clear that your brain is the biological organ. So stop associating your mind and how intelligent you are with your brain, because your mind just works. The brain is just the switching station for your own mind to work. So it's not an insult to you as a person if your cognition is not working okay. And I think when
That's a
people
good
think of
way of
their
putting it.
mind, they think of the brain. That's not your mind. Your mind is you as a person. Your brain is the organ that it works through. So let's protect the organ that it works through so we get to know you.
Yeah. Going back to Dale Bredeston. So I heard about him when I was studying back in like 2014. And at that point, he was being like vilified in the States for saying that he could reverse symptoms of dementia and Alzheimer's. And, he was getting such a hard time. I'm actually so delighted to hear that you're actually following his protocol, because I'm familiar with that as well. And it's amazing how long it has taken for his work now to be sort of out there and for people to be talking about it in a positive light. Getting that information out there, which you are doing, and you have a great Instagram page. I'm going to put details, how people can follow you and everything in the show notes. But getting that information out there can remove the fear the information that there is hope and that you can be empowered to grow your brain and to maintain your cognition and your executive function and all of that. Getting that information out there will remove the fear from people going to be tested. And that fear of the diagnosis isn't so scary when you know actually there's something I can do about it.
Oh, 100%. So, this is a multi-cause disease, Alzheimer's, a multi-cause disease. There's people on the phone to me that tell me what's causing their cognitive problems before we even assess them. It's because I'm not sleeping properly. So, there are things in your lifestyle that and they're not lacking. People don't lack knowledge. There's an intuition within us that know that there's something just not right. Like it's my sleep. Oh, I'm spending too much time on the phone, on Facebook, doom scrolling, whatever it might be. That's what's causing my cognitive decline. Yes, maybe. And I'm low in energy because I'm just older or whatever it might be. And they're telling me the reasons of why their cognition. So if these things are things that you can change, it's not only Dr. Dale Bredeson's work, which credit where credit is due, because he has been on that journey for 20 something years. And just last year, his randomized control trial was published, and 84 people who had a diagnosis of some form of cognitive impairment, mostly Alzheimer's disease, showed an improvement, not just a stabilization, an improvement. People with moderate stage Alzheimer's disease, not able to work, not able to look after themselves, showed an improvement. That is huge.
It's
That is better
huge.
than any drug for Alzheimer's that is €30,000 a month can do. It showed an improvement. So if you have little cognitive changes in your 40s, your 50s, and your 60s, if 84% of people who are already diagnosed and you don't have any diagnosis yet, but what improvements do you think you can make? This is
Yeah,
huge.
it's huge in terms of prevention.
Prevention and reversal. So there's
Mm,
two models that we've learned, recode and precode. At the moment, I'm only practicing precode. Recode is
mm.
a whole other, more extreme, the further you go down the ladder. And the most dangerous thing you can do is just ignore it.
Exactly. Exactly. Staying in that comfort zone ends up not being too comfortable.
Yeah, and everything comes down to a decision, Lynn. And it's a decision if you want to ignore it and let it fester and grow. I ignored mine for a few years. Um, and once I addressed it was when I could actually, took me 7 years to finish college. I couldn't pass third year.
God love you.
I couldn't sit down and do it. So if there's things that you can't do, why put your life on hold? You know,
Exactly. Yeah. And
people listening to this might be, you know, much further on in life than I am. But anyone can put their life on hold because of their cognition. You can come up with all of the excuses to put your life on hold.
yeah. And I mean it's one precious life we get. Like, so we want to be as vibrant and as possible for as long as possible.
Exactly.
What are your plans for NeuroNourish, say 5 years time? Where would you like to see the business?
Yes. So we want to have served a minimum of over, 2 to 3,000 people. So we are living in the most wonderful time in terms of technology and the support and how quick a machine can get to help us, et cetera, et cetera. People are not lacking information or access to information. They're lacking accountability and structure mostly. Um, the information today is that cognitive improvements, if you're noticing the changes, act now and test yourself. And it's not a disease that just, there's no help there for you. Um, but NeuroNourish Clinic, we want to see as, the go-to centre for cognitive prevention in Ireland, and our technology to help I can't be one practitioner to to help everybody in the country. Our technology to help other practitioners help patients. As you can already tell from the way I'm talking, there's a lot of data we're collecting on people to make it
Yes.
as personalized as possible. The more personalized it is, the better results you're going to get. And really helping people across, Ireland, the UK, and beyond with their technology. So
Amazing.
that's I see the future of NeuroNourish Clinic.
Great. And you're based in Cavan at the moment?
I'm based in Cavan at the moment, yes.
Super. Can you see people online, or is it I mean I presume there are some appointments that need to be in clinic.
Mostly we're aiming for a totally online
Okay, great.
service.
Oh,
And
great.
so that's where I see the future. There will be some cognitive tests at the moment that we do in person. But you can do those online once you're able to use a computer, etc.
So that's fantastic. That's another plus for people that in the comfort of their own home, they can carry out these tests with you. And of course, it means that you can serve people from all over the country.
Absolutely.
Brilliant.
So, yeah, we can serve people because we can get bloods done from all over the country. You don't have to come into clinic to do that. We can try and put you somewhere close to where you're living
Mm,
to get your bloods done. Your cognitive tests you can do over online, and then your appointments from the comfort of your own home. And I think for something like cognition, that gives people a safe space, especially if you're testing how your brain is functioning.
absolutely. Emer, I'm so impressed with you and your business. I think that you have a really bright future ahead, and I think you're going to help so many people. I've already some of the people that I've mentioned that I was interviewing it for the podcast are so excited to hear this, you know. So I'll be putting all of your contact details and everything in the show notes. And I'm so grateful for your time. I know you weren't feeling great today, but you're a trooper. And thank you so much.
Thank you very much, Lynn. And it's been an absolute pleasure.
My thanks again to Emer for her time and expertise. And I am delighted to say that she's going to be coming back in a couple of months' time to build on this conversation. So now is time for the store cupboard staple, and we're going to focus on a fatty fish, which is a great source of omega-3 for our brain, and that is sardines. Now, sardines can be one of those foods that people think they hate, but maybe haven't tried in a few years. So just stick with me and you might be persuaded to try them again. So sardines come from the rocky coasts of the Mediterranean, and they were named after the island of Sardinia beside Italy, where they've been fished since ancient Roman times. Fishermen back then preserved them in salt or oil to preserve them to feed armies and sailors who were going away on long voyages, because obviously there's no refrigeration back then. And then when you fast forward to the 19th century, so in 1810, a French inventor called Nicolas Appert perfected canning. And so by the 1820s, sardines were the world's first commercially canned fish. Portugal, Morocco and Thailand are the biggest suppliers nowadays, and we can buy them in olive oil, tomato sauce or brine. They're actually really sustainable as well. But the real benefit of sardines is in the nutrition. They are so nutrient dense and they're small and compact. A single 100-gram tin delivers 25 grams of protein for muscle repair and satiety. They are loaded with omega-3 fatty acids, which fight inflammation and support our brain health by building cell membranes and boosting neurotransmitter function. They actually top the list alongside salmon for those EPA and DHA omegas, which sharpen our memory and help our mood. But there's more. They're actually one of the best sources of vitamin B12 to keep our nerves firing and our energy steady. They're a source of vitamin D for our bones and our immunity. They are a brilliant source of calcium, really high calcium content, because, you know, obviously you're eating the little soft edible bones in them, and they're actually even better than milk. People think it's all about milk for calcium, for osteoporosis prevention, but actually sardines are better. They have selenium, iron and phosphorus for their antioxidants to prevent free radical damage to our cells and for our blood health. They're very low in mercury too, since they're small and short-lived. So you might remember we mentioned before that small fish have less mercury because bigger fish eat small fish, so the mercury content is more dense. So your small fish will have less mercury. So remember, tuna max once a week, but sardines you can eat loads of. Now, studies regularly link oily fish like sardines to slower cognitive decline and lower dementia risk. So basically your brain is going to thank you for eating sardines, and they're inexpensive too, which is definitely a consideration these days. So once we buy them, what are we going to do with them? Well, of course, you just drain the tin and mash the sardines, and then we can mix them in with a variety of different things, whatever you feel like. So a couple of examples would be, you could even add more protein by mixing with some cream cheese, squeeze of lemon juice, bit of black pepper and chopped herbs, and you could serve that up on, you know, a bagel or in a wrap or on a Ryvita, something like that. You could also do it, I like it with sort of, I dice cucumbers and peppers, and I'll mix it with, mix the sardines in and add a little bit of mayo and yogurt. So half mayo, half yogurt, and a little bit of black pepper, and I might put that onto a bagel or in a wrap, or just on a bed of rocket. Obviously, you can add whatever salad vegetables you like to it. You could make a Mediterranean style salad by adding your sardines to some rocket, some cucumber, olives and feta with a nice vinaigrette. You could flake the sardines over a pasta dish with garlic, chili and greens. You can serve them with any eggs on toast. And, you know, again, we want to aim for 2 servings of oily fish a week. Those would be the health guidelines, you know, to get our omega-3s in. Now, it's always good to choose wild caught if you can. And it's best if they're in the tin in water or olive oil, low sodium if possible. So Actually, Shines of Donegal are a fantastic brand for any tinned fish at all, and their sardines are gorgeous. But whatever brand you buy, just make sure they're in water or olive oil. So there you have it. Sardines are ancient, affordable, and brain fuel in a tin. So hopefully there is enough information there to encourage you to add some more whole foods into your shopping trolley this week. Thank you for listening to today's episode. I just wanted to clarify that the podcast is for informational purposes only and does not substitute professional care from a doctor or trained health professional, nor constitute medical advice or services if you're in a position to need either. However, if you found it interesting, you can subscribe to make sure you don't miss future episodes, or sign up for my newsletter on linsharkeynutrition.ie.